Okay, so we continue, and the following topics will be on drugs used in obstetrics. Okay, we'll start with oxytocin, then we'll move on to ergo derivatives like ergometrin, methorzine, then prostaglandins, which includes misoprostol, dinoprostol, and carbaprost, and then finally we'll cover magnesium sulfate. Okay, now starting with oxytocin. What are oxytocics? Okay, they are the substance that possess the power to excite contraction of the uterine muscles. Okay. They are synthesized from the supraoptic and paraventricular nucleus of the hypothalamus, and they are released from okay, poor choice of color. They are released from posterior pituitary. Okay. So, coitus, that is sex, parturition, and suckling. These are the stimulus to release oxytocin from the posterior pituitary. Now moving on to action of oxytocin on different tissue. On uterus, it increases the force and frequency of contraction. Okay, and if we use this in low dose, then there is full relaxation between each contraction. And one of the good thing about oxytocin is that these contractions are physiological, that is with adequate relaxation in between, and they start at the fundus and move down near the cervix. Okay. 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 One more point, that during labor, the oxytocin receptors in the myometrium increases by 100 to 200 fold. Okay, this is important during the labor. How it acts? Okay, oxytocin acts through its receptor in the myometrium and voltage gated calcium channels to initiate myometrial contraction. Also, it stimulates the amniotic and decidual prostaglandin production. Okay, I said, okay, this point is already done, that the uterine contraction elicited by oxytocin are physiological. Okay, moving on to breast. Okay, it is useful in the milk ejection reflex. Okay, this is the milk ejection reflex, that it contracts the myoepithelium of the mammary alveoli and forces the milk into the bigger milk sinusoids. Okay, milk ejection reflex. On cardiovascular system, at higher doses, it causes hypotension, thus might lead to transient drop in BP, blood pressure, reflex tachycardia, and flushing. Okay, using on high dose, it has antidiuretic hormone, thus promoting water retention. Okay, moving on. Uses of the oxytocin drug. Okay, it is used in induction of labor. Okay, but before inducing it or before giving oxytocin, confirm that the presentation of the fetus is correct, the fetus lungs are adequately mature, there is no any cephalopelvic disproportion, there is no any placenta previa, there is no any fetal distress, and there is no any uterine scars. These points are also among the contraindications of use of oxytocin during labor. Okay. Um, okay. The dose of oxytocin for induction of labor in multipara, it is 2.5 units, and it's in primipara it is 5 units. Okay. Why so? Because in multipara the uterus has much more oxytocin receptors than in primi. That's why even lower dose of drug will cause sufficient induction. Okay. The second use is uterine inertia. That's why it is also used in postpartum hemorrhage. Okay, there is I've written here the difference between ergometrin and oxytocin. Okay, one can go through that, but I'll discuss it later after I discuss ergometrin. Okay, the third use is PPH. Fourth use is intranasal form is also, I think it is currently experimental. It is also used in breast engorgement, in the treatment of breast engorgement. The fifth one is oxytocin challenge test. It is used to determine the uteroplacental adequacy in high risk pregnancy. Okay, I've never seen this test being done, but it was mentioned in the books, that's why I've included it. So the uses are induction of labor, uterine inertia in postpartum hemorrhage, breast engorgement, oxytocin challenge test. Okay, and okay, there are a few more uses. We'll continue with them. Okay, we continue with the uses of oxytocin. In labor, it is used in augmentation of labor. It is more preferred for augmentation rather than induction. Okay, for induction, prostaglandins like misoprostol is preferred. It is used in uterine inertia that may lead to PPH. It is also used in active management of third stage of labor. Uh, after the after taking out the placenta or delivery of the placenta, we usually give oxytocin on the thigh 10 units intramuscularly. Okay. There is another point that following expulsion of placenta as an alternative to ergometrin. Okay. In early stages of pregnancy, it is used to accelerate the abortion process and or to stop bleeding following evacuation of the uterus. Okay, in late pregnancy, it is used in induction of labor. Moving on to dangers of oxytocin. Okay, there are two: maternal and fetal. Maternal dangers are that if given in higher dosage, it might lead to uterine hyperstimulation. It might lead to uterine rupture, if especially if the uterus has been previously scarred. Example, if the patient has had uh, prior uterine prior hysterectomy, okay, prior cesarean section, okay, it is also common. Uterine rupture is also common among multipara in patients who present with malpresentation of the fetus. If the pelvis is contracted, then you can see uterine rupture due to oxytocin. Okay, water intoxication, as I've already discussed, that it has antidiuretic effect, especially in higher doses. It may cause hypotension, especially if given in hypovolemic patient or patient with heart disease. And last is antidiuretic, the diuresis. Okay, the fetal dangers are: it may cause fetal distress, it may cause fetal hypoxia or even death due to uterine hyperstimulation. Okay, please note that the adequate contraction are 3 contraction in 10 minutes, with each contraction about 30 seconds each. Okay, more than 30 seconds. 3 contraction in 10 minutes, with each contraction more than 30 seconds. Okay, if there occurs more than 6 contraction in 10 minutes, it is called tachysystole. Okay, now what are the contraindications of oxytocin? Okay, the contraindications of oxytocin are: in pregnancy, if the patient is grand multipara, then risk of uterine rupture is there. Contracted pelvis same, uterine scar same, malpresentation same. Okay, in labor, similar to all contraindication of pregnancy, and it also includes obstructed labor, fetal distress, and if there is incoordinate uterine contractions. Okay, at any time, we do not give oxytocin to patients that are in hypovolemic states, the patients that have cardiac disease. I think this is all about oxytocin. After this, we'll discuss ergometrin or ergo derivatives, that includes ergometrin, methyl ergometrin. Okay, we continue with ergo derivatives. Okay, the ergo derivatives commonly used are ergometrin and methorzine. Okay, they act directly on the myometrium and excite uterine contractions. These contractions come so frequently one after the other with increasing intensity. Okay, that the uterus passes into a state of spasm without relaxations in between. Okay, remember this point. This point is one of the major difference between oxytocin and ergometrin. Okay, It also can increase blood pressure, but in obstetric doses, it is not that significant. Okay, I've already written here that it is 1.5 times more potent than methazine. Okay, the second one is more potent than ergometrin on the uterus. Okay, methazine is also commonly used than ergometrin. In high doses, it increases the peristaltic activity. Okay, what are the side effects? Sorry. Okay, what are the side effects of these ergot derivatives? Okay, these are nausea, vomiting, increase in blood pressure, and if used for many days, then there is decrease in milk secretion after the delivery of baby postpartum. It is dopaminergic effect and thus can create some problems to the baby. Okay, since the mother is since it is interfering with the lactation, so there may be problems. Okay, but the common are nausea and vomiting. There is increased risk of hypertension that may lead to myocardial infarction, stroke. Okay, uh, it also can cause bronchospasm and sometimes gangrene of foot. Okay, on prolonged use, it may cause gangrene of foot, toe. Okay, these are the vasoactive actions. Okay, what are the uses of these ergo derivatives? Okay, prophylactically, they are used in the active management of third stage of labor. Usually after the delivery of anterior shoulder, these are given, especially in those females who are in increased risk of bleeding. Example, if the female has uterine inertia, if the female is in grand multipara, then okay, usually 0.2 to 0.3 milligram is given intramuscularly. Okay. Second is in active management of third stage of labor. It is also prophylactically used. I've already mentioned this. Therapeutically, it is used to stop the atonic uterine bleeding following delivery, abortion, or expulsion of identiform mole. Okay, remember that it should not be used in induction of abortion or induction of labor. Okay, these drugs are usually avoided in. Okay, these drugs are usually avoided in people with vascular disease, hypertension, and toxemia of pregnancy, that is eclampsia, preeclampsia. Okay, severe preeclampsia, eclampsia. Okay, it is also not used in organic cardiac diseases. It is contraindicated during pregnancy and before the third stage of labor. Okay, it is not used in the presence of gangrene, presence of sepsis, because they might lead to gangrene. It is not used in liver, kidney disease. Okay, and in RS positive mother, it is usually not used, avoided, because there is more risk of fetal-maternal microtransfusion that may lead to RH incompatibility in the baby to come. Okay, that is erythroblastosis fetalis. I think this is all about ergot derivatives. Next, we will study prostaglandins, that is misoprostol, dinoprostol, and carboprost, and after that, magnesium sulfate.